Almeda. My name is Logan. I'm a student physical therapist assistant, and I'm going to be going over some stretching and strengthening exercises for you today. Now, it looks like you have a grade 1 ankle inversion sprain. So we are going to want to be avoiding any excessive plantar flexion and inversion. So that means we're going to want to be strengthening those in an isometric way, which that just means that we're not going to be going through that range of motion, but we're still going to be strengthening those muscles. And then we're going to be trying to increase your dorsiflexors and eversion. So I'm going to start off with some stretching today to just really warm up those muscles, and then we'll move into the strengthening exercises. So the first range of motion exercise we're going to be doing is for your dorsiflexors. Now your dorsiflexors are primarily moved by your tibialis anterior. So that is just on the lateral side right here. And that just helps bring your foot up just like that. So we're gonna do a seated calf stretch, and what you're gonna need is a towel to perform this stretch. Now my face is gonna be out of the view of the camera, but what I want you to be focusing on is the motion of my foot and the motion of my knee. So I'm gonna go ahead and grab a towel and perform that stretch for you. So you're gonna be doing this in a long sit position. I really want you to focus on squeezing your core so you're sitting upright, and then we're gonna wrap that towel around your foot, and we're really gonna try to straighten our leg all the way down. So you're really gonna be feeling the stretch right in here, your gastrocnemius and your soleus. So we're gonna pull that towel back, and to make this stretch harder, we're gonna push your knee all the way down. We're gonna hold that for 15 to 30 seconds. Then we're gonna relax. We're gonna relax for about 60 seconds, and then we're gonna go back into that stretch. So hold that for 15 to 30 seconds again. Make sure you're breathing through this exercise. Don't hold your breath. And then to increase the stretch, you're gonna pull your body forward, really making sure that you're relaxing your shoulders, squeezing your core, and then keeping it a neutral spine. So just one more time, really making sure that posture is good and breathing through that exercise. And for 15 to 30 seconds, we want to do this 3 to 4 times. And then we're going to do that once a day. We really want to stretch out these muscles because we use our dorsiflexors when we're walking, running, and it looks like you're a basketball player, so we really want to get those stretched out so we can walk pain-free and do all of the activities that we do on a daily basis with no pain. And then the next exercise we're going to be doing is to increase, your ankle eversion. Now this is a home exercise for you as well. I chose that to be an exercise for you to take home because your eversion range of motion is slightly lower than what I would like you to be at. So we really want to focus on this at home and make sure that we're going through that motion so we can really increase that range of motion. It's super important when you're a basketball player because your ankle everters really help you stabilize and go through motions quickly. So ankle eversion is when, say this is your foot, your sole of your foot turns outward like so, if you can see that. So this is your foot turning outward. So the sole of your foot is turning away from you. The muscles involved are your peroneal muscles, and those are located on the lateral side of your leg as well. And it's important to have full range of motion for an eversion. Like I said earlier, for stabilizing you, because we need stabilizing when we walk, run, jump, and anytime you're on a uneven surface, those everters are firing. When you're doing this exercise, I want you to stop immediately if you feel any increase in pain. or if you hear any popping, and if you were to fall, I need you to call 911 immediately. All right, and then I'm gonna go through the intervention. You can follow all of this on the PDF that I sent you. So I'm just gonna go through step by step. All right, so you can do this in a laying down position or a seated position. I'm actually gonna have my foot along the wall, and I'm gonna post a sticky note on the bottom of my foot so you can really see that motion. So this sticky note's gonna be on the bottom of my foot, and that's just what you're gonna be looking for. So you're gonna be laying down like so. I know you can't see my full pelvis, but it's in a neutral position. My shoulders are relaxed. And like I said earlier, I want you to breathe through this motion. So, I want you to bend your ankle so the bottom of your foot is moving outward. It's not an exaggerated motion. It'll just be nice and slow. But I don't want you to bend your knee outwards, and I don't want your toes out to the side. So your toes are pointed straight up. You're just really everting your foot, bringing that sole to the side. It's not too big of a motion, but you can definitely feel it in your tibialis anterior. So we're gonna hold this ankle in eversion for 10 seconds. We're gonna do that about 10 times. And we want 2 to 3 sets of these. And I want you to make sure that you're tightening your core, your shoulders are relaxed, and your pelvis is neutral. Really making sure that your toes are pointed up to the ceiling and not going towards the middle or outwards. All right, and like I said, I sent this on a PDF, so anytime you have any questions, you can really go back to that and ensure that you're following the right steps. Now, so that was our stretching exercises for your ankle. And now since your ankle is, or your everters and your dorsiflexors are all warmed up, we're gonna go on to strengthening exercises. So like I said earlier in the beginning, we really wanna avoid taking your plantar flexors and your inversion muscles through that full range of motion. And we can do that by doing an isometric strengthening exercise. So that's really gonna strengthen up those muscles, but not take it through that range of motion. So the first exercise we're gonna be doing is a plantar flexor stretch strengthening exercise. So plantar flexion, say this is my foot, your toes are moving away from your shin. So you're pointing your toes right into the ground, just like so, just like that. And that's really gonna be working your soleus and gastrocnemius, which are your muscles, like your calf muscles. It's important to strengthen those because we use those every single day, whether you're walking, running, jumping, which you play basketball, so that's super important. All right. And this strengthening exercise is also on a PDF that I sent to your email. So I'm gonna go through this intervention, and it's step-by-step on the HEP. If you were to feel an increase in pain, I want you to stop immediately, or if you were to fall or can't get up doing this exercise, I need you to call emergency services. Now, you can be doing this exercise either lying down or sitting down. I'm gonna be showing you laying down. So I want you to push your foot up against the wall. I don't want you like this, because then we'll be in plantar flexion, and we really don't want that. So we're gonna put your foot flat on the wall, and I really want you to push your toes into that wall without moving your heel. Just like so, and we're gonna hold that for 10 seconds. Then we're gonna do that 10 times for 2 to 3 sets. So, keeping my heel flat on the ground, I'm keeping my pelvis neutral, my shoulders are relaxed, my core is tight, and I'm breathing through this exercise. And I'm just pushing my toes right into the wall. really making sure that my heel's down so I'm not going into that plantar flexion range of motion. Holding that for 10 seconds and relaxing. And then one more time. All right. And like I said, I sent this exercise to your email with the parameters. So I want you to go ahead and do that exercise and make sure that you know how you can do this. So I'm gonna watch your form, and then if you have any questions, you can feel free to ask me. All right, and then we have one more strengthening exercise, and this is for inversion. So we're gonna be sitting with the inside of your foot placed against the wall. So I'm gonna do this standing up. And inversion is picking your foot up and moving it towards your midline. So pretend this is my foot. We're picking it up and moving it forward, just like so. All right, so we're gonna be doing this standing. You can do this seated as well, whichever you're most comfortable. For stability purposes, I would have you doing this in a seated position. So just go ahead and find a wall, and we're just gonna make sure your toes and your heel is along the wall, and we're just gonna push just like so, as hard as you can without experiencing any pain. I want you to hold this for 10 seconds, and then we're gonna do this for 8 to 12 times, and then we're gonna do this for 3 to 4 reps. So really just focus on having good posture, squeezing your core, keeping your pelvis neutral, and then really keeping both sides of your feet in that wall and really pushing into it. So I don't want you pushing just the toe of your foot onto the wall, but I want heel and toe, and then push really hard into it, just like so. All right. And then if you have any questions at all, you can go ahead and email me, and if you feel any excessive pain, I want you to stop immediately. All right. Thank you so much. Now I'm gonna get on to my next patient, Clarissa. Now it looks like you just had a total knee replacement. So we're gonna be doing some strengthening exercises and some stretching exercises to increase your range of motion in knee extension and knee flexion for both. So I'm gonna have us start with stretching exercises for knee extension. So this is also an HEP that I sent to your email, so you can go ahead and follow along with me. We're gonna be doing the stretch to increase range of motion in knee extension. Knee extension is just straightening your knee. So this is knee flexion, and then this is knee extension. So you can see that you use that motion every single day, whether it's getting in a car, walking, running, standing up. We always are going to be using knee extension, and it's super important so you can walk without an assistive device and getting dressed independently. So we really want to increase our range of motion and extension. The muscles involved are your quadriceps, and those just run on your thigh from your knee to your hip. I want you to stop this exercise if you feel any increase in pain. And if you were to fall or can't get up after this exercise, I need you to call emergency services immediately. Now I'm just gonna go through this intervention so you can follow along with me. So we're gonna be on an elevated surface. I'm gonna have you put your foot up there. Now I know you're not able to get into full extension, so if your knee is bent, that's completely fine. And we're just gonna lay here and let gravity completely work on pushing your knee down. I don't want you contracting any muscles. We're really just gonna be in your end field of range of motion and just really let that gravity help push your knee down. We're gonna hold this for 15 to 30 seconds, and we're gonna do the 4 sets of that once a day. Now if you feel like you get all the way down, just like this, we're gonna add another pillow just to make it higher. I want you to make sure that you're keeping good posture. So I want your hips neutral, your core tight, your shoulders relaxed, because I know this can be uncomfortable for you. Yeah, and then like I said, this is on a PDF, so you can go ahead and follow the parameters and everything on there. All right. So the next exercise that we're going to be doing is to increase your knee flexion range of motion. So if you're comfortable, I want you to be laying in a prone position. And since I know you just had surgery, so I want you to put a rolled up towel or a pillow under your knee, so we're not aggravating that incision at all. So I'm going to have you on your belly, and we're going to wrap a towel or a belt around your ankle. So I'm going to put this under my knee. Like so. I want your hips neutral. I don't want your butt pushed up like that. I want your hips neutral. I want you looking forward, your shoulders nice and relaxed, and your core tight. And we're just gonna slowly flex your knee and bring it to your butt. Now, if this towel is too small, because you don't have that strong of knee flexion, you can grab like a dog leash or a belt so you can be up here. But I really want you to put some resistance so your leg is stretching in that knee flexion. So it's super important to get that full range of motion. So we're gonna hold this for 15 to 30 seconds, and we're gonna do that 4 times a day. And then I want you to rest 60 seconds in between. Just like that. I want you to really concentrate on keeping good posture with this too. Making sure your belly is nice and tight. Just like that. Then go ahead and relax. Now you should stop immediately if you feel any increase in pain or any pain at all, or if you hear any popping noises. All right, and now that we went through all of our stretches and your quads and your hamstrings are all stretched out, we're gonna go ahead and do some strengthening exercises. So one of the first ones that I want to introduce to you is a quad set, and this is also this is also an HEP that I sent you, so you can go ahead and follow along with me. This exercise is to strengthen your knee extensors. Your knee extensors are your quadriceps, so those just lie from your knee into your hip. It's important to strengthen your quads so you can walk around pain-free with exercise. This exercise will help with any stiffness and get blood flowing to help promote healing. I want you to stop if there's any increase in pain. If you were to fall or not be able to get up, I need you to call 911 immediately. And if you have any questions, you can email me at any time. So I'm just gonna go through this intervention and you can go ahead and follow along. Now you can do this in a long sit position or laying down. I'm gonna show you laying down. So this is really, we're just gonna tighten your quad muscles as hard as you can. And that contraction, I want you to hold for 10 seconds. So you should really be feeling this right along your thigh. We're just gonna really squeeze it. We're gonna do that for 10 seconds, 8 to 12 times. We're gonna do this 3 to 4 sets. And I want you to do this at least once a day. But when you're laying down, this would never be a bad exercise just to do to get that blood flowing and to really help strengthen those quad muscles. Be sure to keep good posture. I want your core tight, your pelvis neutral, and your toes pointed up to the ceiling. I don't want them out here or in the middle. I want them nice and straight. Then just really keep holding that quadricep muscle. All right. And the last strengthening exercise, actually, I would like for you to go through the exercise just so I know that you can do it properly and I can see that you know what you're doing, so you can do this at home. All right. And the next strengthening exercise we're going to be doing is prone knee bending. So I want you to roll onto your belly, bend your knees so the heel of your foot moves toward your butt, then relax and allow your foot to return to the start position. So I'm just going to go ahead and show you. We're just going to, just like that. Now this is super important to keep your hips in a neutral position, your belly tight, and your toes, your heel pointed straight up to the ceiling, not out to the side. I really want you to be contracting all of those muscles. Now if that gets too easy for you, I want you to use a resistance band, and just like the towel, I want you to wrap that around your foot. And even if you don't have a resistance band, you can use a towel. Just hold some resistance against it and really push down. Now I don't have a towel long enough right now to show you that, but just do the same motion with resistance, and that'll really be working your hamstring muscles to strengthen those as well. Now, if you have any questions at all, you can feel free to email me at any time of the day. Something to take away from this is really to maintain good posture. So neutral hips, relaxed shoulders, and really tighten your core, and really make sure that you're breathing through all of these exercises. All right, now that's all I have for you today. Thank you so much. Have a good night.